Well, good morning, good afternoon, good evening. Thanks everyone for coming to this event. We are really looking forward to this conversation. We are especially looking forward to it. It is the first one that will organize event that's organized entirely by the members of the group, as opposed to the chairs or the some leaders or other people who said they weren't organizing it. It was internally done by the group. This event is the fourth, I think, in our series that we're doing on accessible meetings in the times of COVID, what that means. And we thank so much the Internet Society who approved our grant that enabled us to have this event. This is part of our series, and as you'll see, we have interpreters for ASL. If you are on a computer, it's when people are showing slides, it's best to pick side by side, because that way you'll be able to spotlight or pin the interpreters. If you have done speaker view, it's harder to do. So if you're on a computer, do side by side. It's on mobile. I think they have a new format that you can move around the people. So that's my suggestions. We have 2 interpreters. They'll be switching off every 15 minutes. We also have our captioners. If you want to see the captioners, you could have 2 formats to doing it. You can put it on the Zoom, or you could put in the live stream link, the stream text link, and I will try to post it, or if the captioner can post it in the chat, that will be great. We are also broadcasting this on live stream, Twitch, and a whole bunch of other channels. If you missed any part of it, feel free to watch it at a later time. But if not, I'm going to turn over to Praveen Misra, who is one of the main organizers of this event. So Praveen.
Thank you, Judith. Just give me a moment. I will bring out my presentation.
One minute, Praveen.
Yeah, Judith, go ahead.
You are co-host already, right?
Yeah.
Okay.
So it won't be a problem. I'm just switching on. I hope my screen is visible.
Yes.
Okay. So first of all, thank you, Judith, for organizing this. I think it has been a participation of all the members, like you said, and I'm happy that there was so much enthusiasm in conducting this session. For that, everyone tried to volunteer and probably give his best into this presentation. And so with that, I will just begin my presentation on the digital accessibility, a facilitator for everyone in the times of COVID. The background of this presentation is basically to make people aware what is accessibility, which was how we started out with this meeting schedule, where people had raised or probably brought out the concern that many of the members here may not be aware about what is accessibility. So accessibility basically is anything where we need to be reaching. So reachability to a place. Now that place could be a physical place, or it could be a virtual place like your internet or any of those digital platforms. So anywhere, wherever you can reach barrier free or without hindrance or problem is how accessibility is defined. So for a normal person, probably it may be easier. So I've given this in this slide, example of forest. In forest, since it's more for the animals and all, so for a human being, it is still there are barriers, and so we create a path, accessible path for us to reach from one destination to the other. Same is the case with your virtual web, where we need to create features or the environment in such a way that people can be able to access it. Now, with a normal person could be able to access to a much greater extent compared to people who are disabled, or in India we call them differently abled, because they may be having some disability which is compensated by some extra qualities or extra senses that they have. So we call them differently abled. That's a word that our government has given to the people with a disability. Just to give the form, I think many of the people had been asking this question also. So ISOC, Internet Society of Computers, we all know. Now accessibility, A is your first word, and then you have those 11 letters and a Y. So A11Y is basically the short form of accessibility. And special interest group, we all know, we are part of this ISOC A11Y SIG. Uh, the epidemic that has been here has changed a lot, especially in terms of how we conduct ourselves in different lifestyles of the day. So, before the COVID or the epidemic that had started, digital or anything of that sort was more of a facilitator. So, to give you an example, probably if you needed to give an application, you could have given a physical application, and in some places there was a time where people could do it online. So it was basically an augmentation for us to be seeing the digital side of it. But the COVID has brought us into a different scenario altogether, where many of the activities that we used to do uh, have now been not possible due to the social distancing that we have to keep. And that is why there has been a greater importance, or I would say stress, on digital platforms. So it has become more of a compulsion and necessity rather than a, uh, what you call facilitator or an extra the feature that we used to be having before the epidemic came. Some of the things uh, COVID has done, it has brought more digital, less physical interactions. There has been lockdowns, libraries have been locked, so people cannot go and read out there. Offices practically closed for visitors. Gatherings and conferences not possible. Going to even schools is not possible for the children. Work from home is what it has been the normal for the time being, and there have been no physical meetings. Now, all these, which was supposed to be a part of our physical and daily life, have been impacted, and which has made us find alternate solutions in the form of digital platforms where social distancing is also maintained, and we are able to perform many of these functions that we could not due to the COVID situation. So libraries, newspapers physically are restricted. So we have to go through the net to read them or to get information. So the internet is a good source for that purpose. Forms, applications we cannot apply by going physically to any counter for that matter. And so we have to apply online. Schools, children cannot go to schools. So we have to have virtual schools running. Virtual meeting like we are doing this meeting are being done because physical gathering and conferences and meetings cannot happen due to social distancing norms. Now, hospitals also have had limited access to the OPDs. Most of the times it is restricted, and so teleconsultation, which has been there for a very long time, has now come into prominence. Online shopping, online payments, these were already there, but now these have come into focus, and a lot of people do not want to go to the market to avoid infections, and probably they do a lot of more shopping, and banking and all has also gone online for that purpose. Now, with all those expansions or in the digital world that has been happening, uh, before the COVID, we had, like I said, it was more of an option, and no one thought about the massive use of digital platforms or digital world to that extent. So our websites still we have 2 to 3% which are accessible fully. Our phones, none of them. Video conferencing, yes, these like we are doing, they are accessible, but still it has to go a lot more way for it to be fully accessible. Uh, I'm happy. I just before this meeting today morning, I had another meeting on Google Meet, and I was impressed with the way that they have done a captioning using artificial intelligence. Maybe it is available in other platforms, but slowly and slowly these things are being devised for making these platforms more accessible. On websites and on forms, captcha has been there, and people have been using it as a security feature. But the same captcha, if you see, many a times you get multiple pictures where you need to click on, say, a street light or a hill or something for that purpose. Now, those captures, as a normal human being or people with eyesight can definitely use, but think of a blind person or a person who is partially blind. Maybe he may not be able to see those pictures and even identify if there is anything like a traffic sign or something into it. So captures are still, many of them are still not accessible. And so we need to be looking at improving them. The banking system. Uh, Many banks have very good portals for the banking system, but they are not accessible to the level that is desired. With the type of codes and everything that you need to give to do a transaction, it I have seen that probably it is still not accessible to the level. Smartphones, again, a very important part of our digital user environment. Uh, they have inbuilt accessibility features, but when you put them on and start using it, you find that there are a lot of bottlenecks and hindrances into it. So technology is improving, and there is sufficient technology that exists. The only thing is that probably we need to see how best we can implement and use them to make the digital world a big accessible place, which has become a very important part of our daily life, especially in this COVID situation. That would definitely serve the purpose that the internet was supposed to be. Internet was supposed to have a place where everyone should have access to it, and everyone should be able to use it in the best possible manner to get the digital information and facilities out of the internet. So probably to realize the true value of internet, it needs to be fully accessible. Now, I've been saying this accessible for a purpose that many of us may be wondering that, yes, we are already accessible. Why do we need it to be? What is that is needed to make it accessible? Yes, we can access, but there are many people who may or may not be able to access it. So some of the peoples with special needs, the visually disabled people, or the hearing impaired people, or people who have motor disability, that is, their movements are restricted, or have cognitive disability, that their probably IQ levels are quite less compared to others, or even the less educated who can probably hear but cannot read. So that is also a category which probably would be much benefited with things becoming more and more accessible. So one is, on one hand, yes, it is our moral responsibility towards our fellow colleagues that we need to have create things that are accessible to them also. And in many countries, there have been laws also which have made it mandatory for uh, most of these equipments or websites or any digital platform to comply with digital with accessibility norms. So there's a compulsion as well as, yes, obviously we have a moral responsibility also towards our fellow colleagues. Now, in the digital world, most of the things that we use, websites, which have text, video, audio, image, forms, help, chat box, captcha, PDFs, scan documents. Then phones, like I said, audio conferencing, video conferencing, webinars, meetings, trainings, and remote access. And many of these are still not very user-friendly or accessible. I'm taking a website, website this thing components, which is supposed to be the most widely used. So you have, everyone uses a website. So you have, one is where how you develop a website, the platform, which is a content management system, or could be any form of the way that you put your contents. Then the platform that delivers it, and obviously the user and equipment which needs to be uh, able to use that assistive technology in the right manner. For this, uh, there has been some guidelines, or you can say a roadmap that was prepared, which is called the Web Content Accessibility Guidelines. And the first version came in 1999, and every 10 years we are seeing one version coming up. So as the technology improves, there have been improvement in the guidelines. In 1999, since we had only mostly HTML, so these guidelines were more focused on HTML. Then we had 10 years after that, we had in 2008 the version 2 that came, where things had gone beyond the HTML to include other types of content, that is basically your PDFs, text, spreadsheets, presentations, ebooks, and videos, audios, everything had come into play. And that is where those things were incorporated. And then quite recently in 2018, the 2.1 version has come, which has been made more focused on the mobile platforms. So probably that is something now, a lot of digital content we access on the web. So that is have been incorporated into it. And these all are have been done based on the three principles of accessibility, viability, and feasibility. So it's not just that probably unrealistic things have been taken into that guidelines, WCAG. It has been thought after, and probably what has been the best part of it is that it is seen from the it is seen that probably the accessibility should not be the only focus. It should be viable and feasible also for it to be implemented. So that is how those guidelines have been formed, which have three levels: level A, level AA, and level AAA. Level A is a basic functionality which you need to have for the content or the digital platform to be accessible. AA is something which augments it to cover more and more groups of people or types of disabilities that are there. And then we have the level AAA, which is something which augments it, but it is desirable at this moment in the form. So if you do it, great. If you are not able to do, you have at least been able to cover most of the group with A and AA. I'm just leaving in the this thing of time. Now WCAG 2.1, the changes, like I said, some of these changes are there, which says that if you have a mobile device or you have any device, if you rotate it, it should be able to still, you should be able to see on your screen Like your PC has a screen which is more on the wider side, on the horizontal length, whereas the mobile is on a vertical length. So those things should be able to cater to, and rolling and all should be bare minimum. That is something for a low vision. You have to have content, hovering content must remain visible while pointer or keyboard is on it. So that is something which has been there. Timeouts, you must be warned of any timeouts that happen, and pointer gesture, that it has multiple gestures or not, essential for the functionality. Then they can also be performed with a single point activation. So you should not be searching about finding out how to activate them. Some of the basic features of a website to be accessible is screen reader functionality, that the entire website content should be readable. Resize of the content should be possible. You should be having alternative text with the images. So when you have an image, there should be a background text to it or an alternative text, which can be read by the screen readers to describe a picture for a person with blindness. Contrast and brightness feature should be there, because there is also a type of disability with in the eyes of people which does not accept too bright a contrast. So for that purpose, you need to have a different contrast level for those people. Audio captioning should be there, and meaningful links to the text. So probably if you have a link, before clicking, you should know where exactly or what exactly is behind that link. And accessible keyboard, this is one of the most important feature for people with blindness. Since they cannot use a mouse, they use the tab button. So the entire content should be organized in such a way that it should be navigatable by the tab button instead of the mouse. And all text and content should be readable by the screen reader. Title of the website should be descriptive. So you know when you go on the website that probably this site belongs to such and such person, or is for such a such thing. All devices should be responsive. So any type of device you have a hardware, it should be responsive, as well as your web content should be seen in the similar way, whether you use Google Chrome or you use Edge or you use Firefox. So irrespective of the browser, the content display should remain the same. Just a tip.
Praveen, are you able to wrap up, because we want to make sure we have time for all the other presentations.
Yes, just 2 minutes. I am winding up my
less than 2 minutes.
Yes. Okay. So this is where you can do something on the accessible to make a web PDF accessible. On the contrast ratio, like I said, you need to have a contrast ratio which should be visible by most people. So the color combination should be quite, in such a way that you should be able to use them. When you do something of form type of a thing, then if there's an error, that error should be shown in more than one way. So instead of just having it highlighted, you should be able to have a image or something which some people with disabilities can be able to see that. So I'm just like for your color combinations, you should use the texture. So if there is a color blindness, they can be able to discriminate with the texture. So I'm just now the order of content itself should be quite means in a form where people can be. If the site is not accessible, it has no use for you to make a good site. So the text should come first, followed by other things, pictures and video, which is the most heaviest content, should be the last one to be downloaded. So I'm just winding up. Okay, so now on the virtual conferencing, can I see the content? Where is the frame of the sign language interpreter? So that is where probably if you are seeing the interpreter, the frame should be in such a way that a person with disability should be able to be seeing that picture frame more elaborately compared to the other ones. And the other ones are the color should not be bright, there should be less trickling, and obviously the caption options. This I'm leaving it because other speakers are already going to cover it. So probably I've tried to finish off with a glimpse of the accessibility. And Judith, probably that's all I have for all of you.
Great, so much. Thanks so much for your great presentation. Sorry we cut you off, but we needed to get moving.
I've been able to cover most of it. Thank you.
Yes, okay. And now we will, Kelly, can you go? Would you like to go next?
I am glad to go next, yes.
Thanks so much.
You bet. I'm going to.
And remember, we're trying to stay within 15 minutes because we want to give chance for the audience to ask questions. If we go over, we won't have, the audience won't have any chance for questions, and that will really be a shame.
Perfect. All right. Well, welcome everyone. Glad to be here today. Thank you for having me participate. And on behalf of humanity, I'd just like to say thank you for joining the global conversation. My hope today is that you will leave this session with a little bit more information than you joined with. And my focus today is on social determinants of health and the impact of both digital and COVID. So the three main points I'd really like to focus on today is have you walk away being able to describe what are social determinants of health, understand both the COVID and digital impact on healthcare in general, and give you some both global, regional, and local resources that may be of assistance as you continue learning more and understanding the impact to your communities. In that sense, the graphic that you see here is a representation of what are the major categories of social determinants of health. And social determinants of health from the Massachusetts Medical Society suggests that there are 6 main categories, as you can see, ranging from food, education, and of course, healthcare, to social impact, environmental impact, and economics. As Praveen mentioned, our accessibility to certain features and functions is not just a form of digital access, but it's also a means of our environment and the circumstances where we live. So when you think about everything that is available to you, your community, your family, excuse me, it's certainly affected by your physical ability, but it's also affected by your environmental ability. So now let's take those concepts and apply them to healthcare. When we think about healthcare, there's some suggestions here from the World Health Organization. So we've just taken those main categories and now we're looking at some specific examples as represented by the World Health Organization. These factors influence our health equity, or rather inequity. Basically, who can or cannot receive healthcare. Looking over these examples, I want you to take a minute and think about your own community. Now consider the impact of COVID on your community. And I'd like to share a brief story. I'm going to use education as a brief example in my community. So in our community, education for young adults, let's say children, has moved entirely online, basically since March of 2020. So it's been almost a full year. This will continue online for the foreseeable future. In our community, coupled with state and local government, they've quickly organized resources, including laptops, online access for students and parents, and provided an online platform and training for educators with complementary resources for both students and parents so we can sort of keep up with our kids to the best of our ability, of course. Even by providing laptops, books, and lunches on occasion for any student or family in need. That's a lot of resources when you take a minute to think about it. But given that brief description that I've provided, would you consider that to be a reasonable approach to tackling COVID in an educational environment? Take a minute and think about that, everything I've just described in terms of resources. And I'm going to challenge the fact that, well, yes, I think that's a reasonable response. On second thought, the physical resources are certainly accessibility on one hand, physical devices, things of that nature. But what about digital accessibility? What about students that don't have ready access to the internet? What if they don't have access to get to a library? They don't have transportation. How do they get online? What if they're not of age to be independent in that regard? Who is able to help them supervise if they're not of age or capacity to self-supervise. So we start thinking about all these different dynamics that affect not only the world of COVID, but in the world of digital means as well. Now I want you to think about that, and we're going to transition into thinking about the impact on healthcare. Let's apply this to healthcare considerations. So there's really two primary considerations as I see it anyway. Number one, is healthcare generally available? And number two, how is healthcare accessed or provided? And when we pause for a moment, I think there's really two nuances to these considerations, at least in my community, and some of these may be applicable in your communities as well. But first, insurance, and who and where, which providers accept insurance. And secondly, and insurance could be substituted with payment. And second, and perhaps most important, what is the default means of accessing that healthcare? Is it in person? Because at least I know in my community, that's our default, of course, as well. So let's take a minute and dive into the COVID impact on healthcare. I've pulled this slide from the CDC, Center for Disease Control. We've probably all seen this a million times by now, but I think the first question that we must ask ourselves is when exploring into the depths of digital and COVID healthcare, first, can we wear a mask to receive the treatment or care that we're pursuing? Can we stay reasonably 6 feet apart? And can we avoid crowds? Being able to answer these questions will likely vary depending on the care needed, the healthcare system in general, and also generally accepted social guidelines and what's available and accessible in your community, combined with, of course, access to resources in your environment. The added elements are, of course, not just us as potential patients, but what about the healthcare providers? What resources do the healthcare teams have? What do they wear? Do they have a mask and a face shield? What are the hygienic circumstances of the environment, including hand washing techniques, frequency, access to soap, clean water? Is it a reliable and clean water source? Some really fundamental questions that we need to ask ourselves. As we look then into, the digital accessibility on healthcare, and ironically, you'll see this hyperlink here at the top. Can virtual medicine really help reduce healthcare disparities? This is an article that literally just came out yesterday from the Consumer Electronics Show. There's some active conversations going on around using digital devices to really make a difference and impact accessibility to healthcare. So it's a very relevant topic right now. But I want to give you guys a scenario that we can kind of breeze through here. And what I've done is I've made it a two-step scenario. So first I'm going to describe the scenario, and then I've got a sort of checklist where I've gone through, and I'm not a doctor. This is a sort of a family circumstance, couple family circumstances I blended together to give us some thought-provoking exercise around, here's a situation, the scenario we have here. What can or cannot become digital, perhaps? So let's just ask ourselves that, and let's think about that as we work through this scenario. So our scenario is we have a patient with a skin abnormality on the right ear. Typical course of evaluation, this is summarized, of course, might be to perhaps see your physician in office for assessment. Perhaps then a biopsy to test for skin cancer. Return to the office to review the results, determine treatment plan, perhaps surgery then to remove the identified area or multiple areas of skin, followed by wound care and follow-up in an incremental pattern to ensure not only recovery, but also checking for additional areas of recurrence of cancer. If needed, of course, then potential chemotherapy or radiation. That's quite a bit of activity and typically would all be in person. So if we then think about what could be digital or remote. And mind you, my background is in technology, so I tend to ask what if and why not. And I've tried to apply those same conversation elements to this chart. And I made this chart, broke down that scenario I just described into different tasks. So the first task would be see your physician for assessment. Could that be digital or remote? I venture to say yes. That could be a phone or video call with a consult and discussion. And as Praveen was mentioning, different types of devices and making those devices not only readily available, but adjustable in screen, the smallest device capacity that could handle a type of consult would certainly be a smartphone. So think about putting a smartphone in your hand and working through this scenario. So the second task would be take a skin biopsy. Well, that's going to have to be in person. So you'd wear a mask, as would your healthcare team, and use COVID precaution. The third step, test the skin for cancer. That's certainly remote. The skin goes to the lab, patient stays home. Then review the results and determine a treatment plan. That, I think, could also be a phone or video consult, review the potential treatment plan, review paperwork provided over email or mobile, discuss it, printing, mail delivery, potentially optional as well. Then surgery, removing the areas of skin. That would certainly have to be in person, wearing a mask, COVID precautions. The next step would be recovery, pain medication, and wound care. I venture to say that could largely be from home with video check-in as well. 1 month follow-up, probably in person is the best if possible. Again, wear a mask, COVID precaution. 3 and 6 month follow-ups from home, perhaps, maybe even utilizing remote patient monitoring, or RPM as referred. And then chemotherapy or radiation as needed. And something that I've recently learned about is chemo can be provided in a tablet or a pill format. So that also could be remote. And it's equally, the circumstances I've been learning about are equally as beneficial as the traditional forms of chemotherapy. So voila. We're able to perform a number of different steps in a healthcare plan in a remote environment. I'd like to wrap it up with some resources for you all. And as you continue to think about different ways that this may apply to your communities, and this scenario I just walked you through is, maybe more on the complex side, but if we were to break that down, there's a really great example I'd like to call out in particular, the University of Cambridge, Shadrach Frimpong from Ghana, who has received a Gates Cambridge scholarship to pursue social determinants of health in Ghana. And he's starting with farming and being able to incorporate getting the right food at the right time to the right people in order to promote accurate healthcare in the environment. A number of different resources here, of course, the World Health Organization, cdc.gov, of course, our special interest group. And I'll invite you to also review the Internet Society's 2021 action plan as well, the New England Journal of Medicine, and the Bill and Melinda Gates Foundation right here. I'm in the Seattle, Washington area, so Bill and Melinda Gates Foundation and the University of Washington Institute for Health Metrics and Evaluation have a joint partnership really to explore what's called the Population Health Initiative. And this is a global initiative for 10 years. It's got another 7 years, I believe, on that initiative. I invite you to take a look at that. In addition to regional resources. So depending on where you are in the World Health Organization actually offers some specific resources for social determinants of health in your area. These are all available on their website, and they go into a fair amount of detail to help you understand and help you make sense of some of the resources that you may be able to further work with. In addition to, of course, healthypeople.gov. And then just some local resources. I was brainstorming how maybe within our communities, we can help in some of the fundamental categories to not only ensure that the healthcare itself, but the surrounding categories of impact from social environments can leverage and make that healthcare experience improved. So for example, even starting from fundamentals of meals and food, are there food opportunities or food growing opportunities, as this example in Ghana? If transportation is needed to access healthcare, What types of transportation are available? Is walking the primary means? Are there transportation assistance programs in your area that can help facilitate folks receiving treatment if they need to go in person? Access to books or Wi-Fi, grant programs, international organizational assistance, of course, other community resources. I know we've got things like Meals on Wheels and transportation for elderly folks and things of that nature. And of course, at a really fundamental level, a sister city partnership is a great way to collaborate, idea share, and really gather that local community together. So with that, I'll wrap up and turn it over to our next speaker. And if you'd like to connect, my contact information is available here as well. Thank you.
Thanks so much. Thanks so much, Kelly. We appreciate it. And to everyone who's requesting, the slides will be available afterwards. They'll be on the live stream link, and then you can, Jolly will be posting them, and then you could watch the presentation again, or just download the slides. So look out for that. We will also send it out to everyone. Emmanuelle, well, I actually, Emmanuelle, do you want to go next, or do you want me to go? You're welcome to go next if you want, Emmanuelle. Are you there, Emmanuelle?
Yes, I'm
Okay.
here.
You can go next.
Okay.
Because I can fine tune mine, however, if I want to make it, if we need more time. So just aim to be done by 10:30 by the 30 minutes on the hour. 15 minutes. Thanks.
Okay. Don't worry. Okay. First of all, good morning, bonjour, buenos días para todos. Thank you to the organizers to invite me, and I will talk about artificial intelligence and the importance of accessibility training. This is me, but you can read about me in the if you download the presentation that is in internet. The COVID-19 teaches us that it was wonderful to improve, to drive in the development of the artificial intelligence. We are using it in to detect the infection, and we are using it even with robots to help in hospitals and Congress and so on. But we have a problem, is that the people are becoming less empathic than ever, and machines learn what people know implicitly. This means that machines are learning that things like flowers are pleasantness, and that things like insects are unpleasantness, and this is not true. This is not really true, not all the time. And they are learning gender biases, like women are near to arts and humanities, and men are working or near to maths and engineering. But this is not really true. So if you look for woman in any search engine, you will find a lot of white women, but not so much dark-skinned women. And these biases are learned. We have a proof in Tide that was a chatbot created by Microsoft for the Western market. And it had to be closed only 16 hours after its launch. because she learning to say a lot of bad things, like Hitler did nothing wrong, or like the Holocaust was an invention. But we have another example, very, very different. This is a Chayo Eyes, and she's a chatbot like Tai, created by Microsoft too, but for the Chinese market. And she's working from 2014 without any problem. And she is now a poet, a singer, a designer, a journalist. She learned a lot of very nice things to do because she is talking, she is interacting with people from China. And for me, it's clear that this cultural and educational difference play a very important role here in this case. And for me, it's clear too that this is why it's very important training in accessibility, tolerance, and acceptance of diversity. Because these decision-taking algorithms can ruin lives, really. There are a lot of examples, and one is not very important, but is an example, is this DJ that is from New Zealand, and the passport was denied because the system thinks that he has in this photo the eyes closed, but he's not. It's only that the system was learning, the system was teaching with photos of Occidental people, and so the system can identify this man like a person with the eyes open. So this is why we need ethical consideration in creating artificial intelligence. And in Europe, we have now the ethics guidelines for trustworthy artificial intelligence. These guidelines have the guideline 5, diversity, non-discrimination, and honesty, ask for avoid unfair biases, and ask for to apply the guidelines of accessibility and universal design, and ask for participation of all interested parties, like people with disability. When we learn accessibility, we need to know the needs and preferences of the people. And when we design a something web content accessibility guidelines compliant, we need to take in account the needs and preferences of all type of people. And when we review accessibility, we need to know the navigation strategies of the people in account too. So we need to do training in accessibility, but we need to take care because designers and developers need to have knowledge, skills, and competence to be able to detect accessibility barriers and eliminate them. But it's important that they don't depend on the accessibility given by the framework. There are some frameworks to create artificial intelligence and systems. So in some situation, these frameworks can do suggestions that are not so good for accessibility. So we need to train all the designers and developers in accessibility to be sure that they apply the accessibility guidelines and take in account the needs and preferences of all type of person. So we need to taking into account ethical consideration and think is not training in accessibility essential to prevent intelligent agents from being agents of evil, or to what extent can training on accessibility affects the ethical behavior of artificial intelligence, for example. From the CIDAR Foundation, we teach with these personas. This means characters that represent different type of persons that have some needs and preferences that are different, that are diverse, because they are people with disability, or without people without disability but have any condition. So these personas are very important to understand, are very important to learn about accessibility, because it's more easy to relate these needs and preferences with a face, with history that can help to remember these needs and preferences, and apply the guidelines that are need to cover this needs and preference. So in conclusion, training in accessibility, tolerance, and acceptance of diversity is an effective means to fight against the biases currently present by artificial intelligence, while creating a truly inclusive education. This is my thesis, and I think that this will benefit all of us. So thank you very much for your attention.
Thank you so much, Emmanuelle, and thanks for getting us back on time, which is great. So my presentation will be fairly quick. I'm just going to introduce everyone as well, and I hope everyone also who's on here and who has registered has signed on to become a member of our chapter. It's a little bit of a complicated process because you have to first become a member of the Global Internet Society. Then you have to fill out our form, but a form is, we are struggling to get the form to be sent to you as soon as you indicate interest. But if you then fill out the form, and only when you fill out the form are you accepted as a member of our chapter. And the form is basically, we want to get some more information from you, who you are, what your skills are, what you would like to help out on. So my topic was going to be on how we're going to do outreach. This is one of our ways of trying to get new members, is with these presentations, with other blogs. If everyone wants to write a blog, that we post on our website or on the Internet Society website, feel free, please send us the blog, and our team will review it, and then we can post on it, and then we could tweet it on different platforms that the Internet Society uses. As I said in the beginning, this presentation was done because we applied for what is called a small grant. The Internet Society runs a program called, which is now within their foundation, called Beyond the Net. And then Beyond the Net enables us, anyone in the chapter, to submit a grant proposal that, if approved by the executive team, as well as working with you, we would submit it, and then you can get funded up to $3,500 US. And these are for series of talks like this. It enables us to provide the captioning and the ASL sign language interpretation, or if we want language interpretation, we would have to pay for all that. And that is one way of doing it in a series. If you have a series of topics, or if you want to do something in your country. I know our president Mohammed Shabir is talking about doing a forum on financial inclusion and financial banking, or working with the library in Pakistan and trying to get them to be more accessible. So whatever program you may want to do, we were happy to let you to see about if you can implement your small program, and this is the funds that you could use to do them. We could do 2 events, 2 grants a year. So we can have one for series and one for other projects. If there's a larger project that is going to take over a year and require a lot more money, you could look at the large grant programs. And if you look at Beyond the Net site, it's in the, if you go into isacfoundation.org, then you look at Beyond the Net sites, Beyond the Net programs. This is going to be small grants. That site also has a lot of other information about other programs outside of the internet to the chapter framework, because they do a lot of other work, some of them only in specific countries and some in others. Another way with we can get that we also can do outreach is after COVID, when we start doing live events, in-person events, if you want to do pamphlets or do other brochures about it, that is something you could also do. And we do have funding for putting out publications. Everyone on the board has accessible business cards that are double-sided and have English and Braille on it. They're from a great company in Australia that is a 3D AI process that is really high quality cards and inexpensive for Braille cards, that is. But you know, there's other different ways of doing other things, like for what outreach, we encourage other groups to hold any events that they want. And we can always live stream them. And you just write to, what is it, Jolly, is it Webmaster? Jolly will post a link if you want to get your events webcast. But there's a lot of different ways to do outreach. And these are just some of them to do. And we encourage a lot of different other people to do as many events as possible, because what we want to do is bring outreach to others. Also, work with your governments. If the governments are writing policies, work with them, because many others do not realize that they are not being accessible to others. They think they don't understand the idea of a platform. They don't understand that screen readers cannot read what's on the screen. And they're just not aware of what things need to be done. And often it takes a sort of an education. And so you just really have to educate a lot of people. And that could be done in forms of blogs or other type of presentations. Because what we found is people are willing to make changes. They just totally unaware, just like they were unaware. It hasn't dawned on them that they need interpretation in other languages. It hasn't dawned on them that, oh, we need captioning. It's only with the pandemic that people realize, oh, we need captioning because we're not there in person. And so I think what we need to do a lot more of is outreach to other groups. Since we're a global organization, we can do outreach into many different governments and many different areas who are writing policies, or even many different associations. The people are just generally, what we found is not aware, and they like to be made aware. one of the things that we didn't do on this time, but we try to encourage others, is to put their presentations online so that we can post a link to the presentations in the chat, or send them out ahead of time, because people with screen readers cannot see the screen, and so they can't see the presentations. And so that's another thing that you want to be made aware of. Also, we had a presentation a while ago done by Greg Shatton on accessible documents, how to make documents accessible, how to make social media posts accessible, the importance of alt text. Professor Misra talked about this in a rush state in his excellent presentation, but that is something that we also want to encourage. And I think that's something you can work on encouraging others to do, and to get more focus on that. I think I will reserve the rest of my time for the Q&A, and we can move on to Kindy's presentation, where I will be sharing the screen as he's on his mobile device. Kindy, do you want to go? Let me just start sharing the screen. Okay, Kindy. Can you speak? We can't hear you.
Yes, hello, donc, c'est un plaisir pour moi d'être avec vous en ce matin ou en cet après-midi pour parler de...
Kindy, if you need to speak in English, we have no French translation on here.
Oh, I don't speak English very well.
Do we have anyone who can help translate for Kindy in French? Normally we don't have French translation. We are looking maybe next time to have French translation, but right now we didn't have the funding for French translation. So we can get your slides translated, but unfortunately we can't do a French translation right now. Sorry about that, but we had thought that we had made that clear beforehand. And if we don't have anyone else who can translate for him, we'll just have to move on to another group. If anyone wants to raise their hand in the next 5 minutes to help Kindy. Otherwise, we'll just have to move on, and we'll put his presentations up on the panel.
I can try to translate, but I'm not a translator, so I can try it, but I think that it's better if you do the presentation in the next meeting with a person that can, I can help you to translate the presentation. So if for the next meeting we have a person that can do the interpretation, I think that this can be better, because it's not good to have not so good interpreter.
Yes, thanks so much. Yeah, so maybe, so Kindy, what we also suggest to you is work with other people in ISOC Haiti who can help you do the translation. And otherwise, we would have to get either funding for that, or we would have to do it in coordination with the regional bureau director of Internet Society, and have them sponsoring the language, because the way we would have to use a different Zoom room to have a separate translator using the Zoom language features. So we couldn't do it for this one, but let's now, okay, so we're not gonna go with Kindy's, but then we'll turn it open. We'll stop the screen share and we will turn it over. Oh, we'll turn it over. Why don't we just turn it over to questions and answers? Because it's right. Other people can help translate, but we would like Kindy to be able to give his presentation. And if it doesn't work for this time, we'll try it a future time. But now that we have lots of time.
I just saw somebody there saying they want to translate in the chat. In the
Yeah,
chat room.
Zachary, is that Zachary? Yeah, so we're gonna, let me just open it up to questions and answers right now. And Kindy, it will be difficult to do the other translations because we don't have a language captioner. We don't have the Zoom set up for that. The Zoom, to do the language translation, to have simultaneous language translation requires a different Zoom channel. And we don't have the feature set up on this one for that. So we would have to cut in significantly to the Q&A time. So why don't we just go with Q&A right now? And then we'll hopefully in the next presentation, we'll be able to put Kindy's in as well as the next series. And how this is gonna go is that we will work with Praveen to put in your series. We'll choose a date and we'll choose a series and we'll work, if we want interpretation, we have to work with the regional bureau for that, but we can do that. And so just go and work with Praveen, and just as we have, he's gonna help you organize. Sorry, Jolly. He's gonna help you organize the event, and that way we can work to get a setup for language interpretation. But let's open the question and answer periods. So please raise your hand so that we could find out who has questions and who wants to go first. Do we have any questions on here? And if you don't feel comfortable raising your hand, please type it in the chat and we will read it for you.
Yes, Judith, this is for the record, this is Muhammad Shabir Awan, the president of International Society Accessibility Special Interest Group. If you don't have a specific question or want to comment to presentation or generally want a comment on to accessibility, please feel free to chip in.
Thanks so much, Shabir. Yes, any comments, any questions? If not, we could always give more time to Mr. Praveen, who had an excellent presentation, but that we breezed right through it. But also, if you have any other things, we have a lot of newer people on this panel, on the show, and so people coming in late and others, so let us know. We'll wait another minute or two, and then Mr. Praveen can also go on, and he can also sort of finish his excellent presentation that we just breeze right over, since we have, and if we have questions, then we'll just stop it and then we'll answer your questions.
Hi, Judith. Can I interrupt a little bit, please?
Yeah, sure.
Hi, Justin here from Nairobi. I'm not a member, but I just participated to listen and watch what's happening. Yeah, we just came across one accessibility difficulty right now when Kindy could not present his well-prepared presentation in French. And we do have a translator who has been engaged to do that. So to me, throughout my life with internet issues, language has been a very big challenge because the language of the internet is English. And when other global regions came in, Chinese wanted, Russia wanted, it became a big issue about 10 years, 8 years ago. So how would, you just mentioned that people who would like to be supported to have access to the internet tools and applications during this COVID period could be supported. How could language deficiency, or I mean, how could the language issue be solved? Which channels should groups of people or groups of language interested people go and approach the internet society so that they can benefit just like everybody else who is access to the internet? That's my kind of question and comment as well.
Sure.
Thank you.
Yashin, thanks so much for your question. As I mentioned before, we requested when we were recruiting presentations, we were looking for only right now for people to speak English, because we have grant funding, and in the grant funding, we specified that we were looking for captioning and sign language interpretation. And we received funding for that. If we wanted to do a presentation in other languages, we would have to partner with the regional bureaus of ISAC. Each of the regional bureaus not only has a laws of Zoom, but also has funding for their region. So for instance, in our region, if we had more notice about this issue, we could have worked with the North American and Caribbean region to do French captioning. They just took over the Caribbean area recently, and they're not necessarily set up for French captioners right now. They are working to get French captioners, French language interpreters on theirs. And they will then shortly be able to do, whenever they host an event, they will be able to do it in French, Spanish, and English. Currently, the African Bureau does it in multiple languages because they have that set up. And other ones do it in languages. Language support is extremely important, but as a special interest group or as a chapter, we don't have the funding for that. There are opportunities for other sources to do it, but they are more AI captionings or AI interpretings. For instance, you can use Google Translate to translate the stream text link. You could use also there's a streamer.solutions, supposedly also doing those, but these are all AI solutions. They do leave out the common person, but right now for here, this Zoom channel we are using does not have the facility to do simultaneous interpretation channels. There are other Zoom channels, the Pro account. So if we wanted to do it, we would have to partner, just like when we had wanted to do a webinar format. We don't have webinars set up on this one. We partnered with one of the ISAC bureaus and they hosted it for us. So that is something that we could do. And if it's region-wide, like for instance, if they're supporting Kindi, if they were supporting ISAC Haiti, then yes, they would have French because that is their work in supporting one of their chapters. But that all has to be agreed on in advance. And so we will work to support others, but we would have to work with our partners and the regional director, and it has to be approved by the regional director. And so that is one, yes. So as Jolly mentioned, if we want to do a Francophone focus one, we could work with the Francophone chapters And many one of those has the funding to do it. We just don't have the funding for this right now, and we are sorry about that. Any other questions? So Praveen, do you want to give a short, more summary of what of the sections that you skipped? I can give you 10 minutes.
Well, instead of going into the presentation, I think I heard presentations of other people. And like you said, that probably many countries still need to make laws regarding accessibility. I would suggest that if a list of some of these country laws can be made available on our accessibility websites, people can take a reference from those acts and probably help their governments bring in place some laws regarding accessibility. We in India have already had a law that was passed in 2016, and it is a very elaborate law which mandates accessibility for all in all domains, including your physical forms as well as digital form. And I am sure that in many countries such laws would be there, and people can be benefited from what has been done earlier and take it up from there. So that's a suggestion that I have for members as well as Judith. Probably if somebody can compile, or probably members can send from their countries if they have a good law, and so those can be put as a reference law or cite something which can benefit other countries to do it.
Thanks so much for that. Yeah, if anyone wants to start that process, we're happy to find a place to host it all. But it's a process. There are a lot of laws out there, and you just have to work with others. As a consultant, I'm working with the government of Papua New Guinea, and I looked at it, the law that we're creating, with the accessibility framework of trying to figure out how to put new things in, make sure that when you're working on digital government issues, that it's accessible to people with disabilities. But there's different other parts you can put in the law. And there's also other areas on the website, and I am going to put someone on this. I have a couple people I can put on the spot here. We have a couple of people, Jerry Ellis, who works with in UK, and he's also been very active in our IGF Dynamic Coalition. If he wants to say something, or Greg Shatton, who could talk about different laws. He's also on our board. Any of those want to go about, give a few comments on that, you're welcome to do that.
Hello, Judith. Jerry Ellis here. How are you doing?
Great. Thanks, Jerry. Jerry, could you speak a little louder?
Sure.
Thanks.
Yeah.
That should be better now because I'm speaking directly to the machine. I'm not an expert in law, but I did have a particular interest in one area that was spoken about today, which is artificial intelligence. I'm actually doing a postgraduate course at the moment in artificial intelligence. And I was wondering from Emmanuelle, does she know of any of the tools which are used in that area? If there's investigation into making them accessible. So stuff like Jupyter Notebooks and Tableau and these statistical tools and tools for presenting data are particularly inaccessible. So does Emmanuelle know anything about making those tools accessible?
Well, there are very, very few work in accessibility in artificial intelligence. This is very sad, but there are not so much academic work about accessibility in artificial intelligence. I know some articles, but some papers about, but there are not so much. I'm sorry.
So, Judith, from the legislation point of view, where I am in Ireland, not the UK, we do have some legislation, but it is 20 odd years old. I don't think the legislation that we have in Ireland would be a good example, but I'd be interested to help. I will help if I can with your compilation of other legislation information from elsewhere.
We have, as I said before, in Europe, we have the guidelines for artificial intelligence, and these guidelines take in account accessibility. So in Europe, we are working to have trusty artificial intelligence, but there are not so much work in the frameworks. For example, we can find frameworks to make chatbots or something like that, but these frameworks are not so good in accessibility, and this is sad from my point of view, naturally.
Well, my background is technology, and I'm interested in artificial intelligence. As I say, I'm studying it at the moment. So it's probably an area I'd probably be better able to contribute. And I know Klaus, who from Austria, who's involved in those frameworks and trying to get accessibility involved. So it's probably an area I will get into more so in the next 6 months or so.
Thanks so much. Yeah, and it's also pressure on the governments on other things. If governments say that if you're offering a offering a service to the public in the U.S., there's a lot of companies who are using the ADA Act, that they are claiming that there are violations of that. If a service is available to the public, if it's a private service, then it's up to the people to pressure them. But if it's available to the public, a lot of corporations have been sued under the ADA because they are in the US, because they are violating the law. It's a gray area here, but it's also work that's been done on that. We have a couple hands up. I want to call on Arby. I hope I pronounced your first name correctly. Arby? We can't hear you yet. If not, Arby will get to you later. I'll call on Shabir. Shabir?
Yes, Judith. Thank you, Praveen, for raising this point regarding the accessibility laws to be placed on the Accessibility SIG website. Before, I'd be glad to have these laws on the Accessibility SIG website, but we'll have to be clear first that what kind of laws are we interested in, because there may be very few in the same country. If I give the example of Pakistan, we passed an IT policy in 2018, which contains a complete chapter that addresses the needs of the requirements of persons with disabilities. Then there is a law at federal level, which is the national level, dealing with the accessibility related issues of persons with disabilities. Then the State Bank of Pakistan, which is also a national company, separately addresses the banking needs of persons with visual impairment. And then there is the Higher Education Commission, which has a complete accessible policy for persons with disabilities. My suggestion here would be if someone is ready to take on the responsibility, please contact us offline, and we would be glad to put you in contact with Jolly McFly, who is the administrator of Accessibility SIG, to create a page on the Accessibility SIG website, and we can gather all these laws. My suggestion would be to gather laws that are related to technology, because accessibility specialist interest group of the Internet Society deals with the digital and web accessibility. So other accessibility, physical accessibility is also important, but our work falls mostly in the domain of digital technology. So we should limit ourselves to these laws and policies. Secondly, Jerry makes a very valid point about the lack of technology and accessible technology tools in the domain of artificial intelligence. And probably this could be one of the areas where we can organize our next webinar on. Thank you.
Thanks so much. We only have a few minutes left. I'm going to try for Arby again. Arby? I guess you're not there. Andy, do you have something quick to say?
Quick. Okay. AI is really, really important because it's been embedded in the language models that people are using for translation and for automatic interpretation now, which, like it or not, is being used extensively. I just want to repeat one of the things that I said at a previous event, that we are missing a model, a framework to pull us all together. I believe there is one, and I hope you'll let me present on it next time, which is user needs for accessibility.
Sorry?
Which is user needs for accessibility, and they are universal. People are, okay, we're all kind of diverse and individual and all that stuff, but the ways in which we're diverse and individual are not different in different countries. They are the same, and you can express them in user needs that are common to, you know, a lot of us. So I hope I'll be invited to present on that at a future event.
Yes, Andy, that would be excellent. Please work with Praveen. He's organizing the schedule.
Yeah.
Okay.
Do you hear me now? Sorry?
Yeah, Arby, we can hear you now.
Yeah, I'm sorry. In fact, I had to reset up Zoom for the audio of Zoom. So in fact, thank you too much for the invitation, and I'm very interested with this question, or the issues related to accessibility through the web, as I'm working on smart cities, on an inclusive way, how to make smart cities inclusive through our technology. And I think that there is a very important part to include in the work, which is the research. I think that I'm from Laval University in Canada, and I think that if we can work together, and if we can, involve research in this area, we can have, let's say, we can have a significant recommendations, and we can have even significant materials to share with government agencies and even with engineers to see how to consider persons with disabilities in the web of today. Thank you.
Thanks so much, Arby. Greg, quick.
Thanks, Judith. This is Greg Shatton. And just two quick points on the law. First, I'm happy to give a presentation in a future program on digital accessibility and the law. I'm an attorney in private practice in New York, and practice in this area, among others. I will say that in the US, the Americans with Disabilities Act does not reach software. It reaches websites, and it reaches mobile apps, most likely, but it definitely does not reach software. And that's a huge problem when it comes to AI, when you're mentioning things like Tableau, or when you're mentioning, you know, any AI software. So this is something that is, you know, a big problem with future regulation or future law that may change. And obviously we're having a change in administration, and hopefully there'll be a greater focus in the US on improving our accessibility laws and regulations. But you know, that is a big hole at the moment. And there were 15 years of attempts to move the ADA into better digital accessibility regulations. They were unsuccessful, and then they were stopped by the current administration. The new administration hopefully will pick them up. So happy to talk about this in the future, and happy to contribute to any knowledge base that we have about digital accessibility laws. Thanks.
Thanks so much, Greg. Yes, I think that would be a great program for the future on this. Can we get talk to the ASL, can we get a few more minutes of time so we can answer this one more question? Yeah, great. Okay, Dr. Ashutosh?
Yeah, my question is Mr. Praveen, please highlight those points which is mandatory for any developer to develop a accessible online platform.
I will have to take out my presentation regarding the things that you said, because there is so there's only one website, one slide in my presentation. The presentation is already being shared, which talks about more on the accessibility of the web or the websites, which summarizes that the web content should be accessible. You should have the pictures and all should have an alt text behind them. There should be captioning on the videos, and obviously you should have methods of controlling the contrast for persons who are allergic to high contrast. So those things are there as part of the presentation, which is already being shared on the group, and probably you can have a look at it.
Thanks so much, Praveen, for that. Also, Jolly will post in the chat the link to our past presentation that Greg had done on accessible documents. And then that, and is also available on our website. But with that, we are going to shortly end this program, because we had a lot of other work. We wanted to also call your attention, as Jolly put in the chat, that there will be an ISOC 2021 action plan call on January 28th. He put the link in the chat if anyone wants to go in there. And also, I repeat, we look, you know, as we would need language support for the other one, maybe we'll do, we are doing, our next event is going to be, I think it's going to be our next event, our partnership with ISOC Armenia, and we are going to be talking about that. And maybe in the last minute or two, Igor, if you want to give like a 1-minute introduction, introduce yourself, and that's going to be probably our next event. I know, Igor, I'm sorry, I just put you on the spot there. Let's see if he's ready. They are with ISOC Armenia, and they've been doing a large number of work with people with disabilities. They've been, throughout the years, they've been receiving, applying for grants from the Internet Society to do work on accessibility within their country. And so we're going to be talking with them later in February to discuss, to learn about some of their work and what they've been doing. And then we also would have the event that Greg scheduled. I think if we're gonna do language events, we probably be best to put it in another grant proposal where we specify that. And so that is, so please work with us on specifying that. And I know we're way over time, so I just want to thank everyone for coming. And I would like to reach out to us and help us schedule our future events. Also help us write grant proposals so we can get funding for future events so that we could have language capabilities on them. If we put them in topics, then we could do it. But anyway, thanks again. And remember to sign up and become an ISAC member if you're not an ISAC member already. And with that, I want to say good morning, good afternoon, and good evening, and look forward to seeing you online. Bye.